we see that people that have multiple morbidities have a higher likelihood of, contracting COVID and then also, dying from COVID. So why do we see an overrepresentation of chronic diseases in our communities?
I'm happy to start. I think, at
Oh,
the beginning of, yeah, at the beginning of this pandemic, I did a webinar with some really big giants in health disparities research, and I asked them if they were surprised to see some of the disparities that are going on with COVID-19 in particular. And the answer was sadly no, because I think if you pull any disease kind of across the board, we see some similar disparities, especially among Black and Hispanic populations. And the thing that I think about as a researcher and what I call a social epidemiologist, which is somebody who studies the social conditions of that people live their lives in and how that affects their health, is that when we think about the Black population, the Black communities, and the history of the United States, our communities have been put in situations that uh, increase our exposure to bad social conditions. And those social conditions ultimately can increase our risk of these chronic diseases. And so, um, an example that you'll hear a lot is the history of redlining in this country, which, for those people who might not be familiar, this is this was basically the practice of making sure that Black people only lived in certain areas of town and that they remained segregated. And there was control of the government by of the ability to move around and buy and purchase housing. And so, what does that end up ultimately meaning is that the populations or Black communities live in neighborhoods that are not as good as white communities. And what that looks like is not having green space to run around and exercise. It looks like liquor stores being disproportionately placed in our neighborhoods. It looks like tobacco industries targeting Black neighborhoods. Um, it looks like having higher exposure to pollutants. And it looks like fast food restaurants being placed strategically in our communities. And so when you think about all of those things kind of stacked up against us, and you know that all of those things that I mentioned are directly related to some of the chronic diseases that we see, like high blood pressure, obesity or overweight, asthma, all these things, right, that are end up being important risk factors for something like COVID-19. Then what we call that in research is that we call it structural racism, or that there are structures that were set up that are embedded in the history of this country that made it difficult for us to come out on top. And that's what's reflected. That's what we see, and we see it across the board for a lot of things.